Umbilical Hernia Repair Introduction. Can you point to the muscles of the abdomen? Choose one of the following options. Correct. These are the muscles of the abdomen. Which of the following pictures shows a hernia? Choose one of the following options. Correct. This diagram shows a hernia. A laparoscopic hernia repair allows the patient to recover faster. Select true or false. Correct. This operation allows a faster recovery. Are strokes and heart attacks common during and after this operation? Select yes or no. Correct. Anesthesia is now very safe. However, the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as strokes and lung problems. Blood clots in the legs after an operation are harmless. Select true or false. Correct. Blood clots in the legs are very dangerous, even though they are unlikely to happen. The symptoms may include swelling of the leg, shortness of breath, and chest pain. Very rarely, a blood clot can go to the lungs and cause death without giving any other symptom. Are infections very common after surgery? Select yes or no. Correct. Infections are very rare. Though rare, infections, as well as bleeding and scarring, may occur. It is impossible to injure any of the internal organs in the abdomen. Select true or false. Correct. Abdominal organs such as liver and intestines could rarely be injured. Hernias may develop. Death is extremely unlikely, but possible. The operation is always successful. Select true or false. Correct. Though the operation is almost always successful, occasionally a hernia could recur and another operation may be necessary.
Thank you for using Explain.